look at the body a little bit more holistically. We spend a little bit more time with our patients and treat generally in a way in which we can start to allow for more of a regulation of the nervous system or of the body by utilising different techniques that a physio or a chiropractor generally would, and start to enable the body's mechanics to be able to heal in a faster way or optimally.
Okay, regulation of the nervous system. Can you elaborate on that a little bit?
We talk about it a lot within breath work, where it's able to be able to change between parasympathetic and sympathetic, but it's also allowing the body to be able to shift into more of a health response, or to move further or optimize its pathways into healing faster. So if it's in regards to how I would generally treat, it's about how do we optimally get the body to move and function, and then in the end increase its immune response or whatever is necessary to be able to get the person out of whatever condition or dysfunction that they're currently in.
And what are the most common dysfunctions or conditions you come across?
A lot of the times now it's quite due to work posture or whether or not it's structural issues. You obviously see scoliosis or curvatures, lateral curvatures of the spine. We also have a lot of chronic conditions that are currently popping up with regards to like migraines. We get, COVID was a big one recently with long COVID patients and some issues around that world, which can also affect the nervous system and how they regulate or heal. We see a lot of issues around osteoarthritis or conditions related to that, or structural abnormalities. And then we also deal with a little bit deeper with regards to the neurological system, and then even down to the gastrointestinal system or the digestive system.
What's your kind of prescription? On average, what is it saying? Hey, I advise you to do this, this, and this. What would be a typical kind of prescription from you, if prescription is the right word? Yeah,
I think that every element of treatment should involve some rehabilitation or at least a prescription of a program. It sort of depends on what walks through the door. Obviously everyone's different, so we can alter the plan or the treatment plan depending on what we're seeing or what comes through. So it's hard to say. Look, with any chronic condition, there's obviously more in-depth case history and chats that we'll probably go through to be able to understand the person, and then give them a plan that's more suited to them. So everything's individual. And then we'll go through, if it's necessary to add in some exercise rehabilitation, we will do so. But also a lot of the times it can be, or movement advice would be a better term. We can also give some slower approaches, whether it's through stretching or mobility, or specifically working through different areas in the case of some yoga, people doing yoga.
And so you're going to be consulting obviously on a yoga for men, and each patient or each student or participant will come to you before we engage in the yoga for men. What's a major difference you find between men and women in terms of when they come to see you?
Women are generally more likely to come in a little bit earlier with regards to their body. I find that they're a little bit more self-aware with how they move, how they feel, what their emotions are sort of telling them. But generally they have a lot more conditions that are present. With regards to if they're in their later years, so some osteoporosis or some other hormonal changes or so forth. Whereas men are generally less likely to come through until something reaches a tipping point, where they'll, whether it's they have an issue with their knees or their back or their lower back, or they think that they can work through it or change it themselves or push through the certain pain. Whereas it's always better, I find from my experience, is to tackle it early. Go in, find a way to change the course of whatever is occurring, and then give them rehabilitation or advice around fixing it before it can then progress.
Okay, so men are less likely to access preventative care than women?
Very much so.
How's your yoga practice?
It definitely could improve.
What's the area of your body that is least mobile for you?
My lower back, believe it or not, as an osteopath. It's the spot that I know that I need to work further on. And because I because I treat with a non-movable table just because it's easier and it's cheaper. I get quite stiff through my lower back, and I could work through that area more.
What would you prescribe yourself? What have you prescribed you? What's the stretch or the move or the thing that you should be doing for your own lower
I have
back?
a routine that I know that I need to do continually to be able to open up my lower back. So there's some reach throughs, some bended knee rocks side to side, as well as some stretches, making sure my hamstrings are nice and loose and that I work through my adductors because they like to keep me nice and tight. And from there, once I'm able to be able to release off all of the structures that I feel like I need to, I find that I'm able to flex and move and shift in a way that feels more limber and more mobile and also supported.
And so what kind of movement exercises do you tend to do? When you're prescribing movement exercises for rehabilitation, do you prescribe them in sets of 3 or a certain amount of time, or how do you generally, let's say, structure that sort of a program for somebody?
Yeah, if it depends if we're sort of looking at 3 different areas. If we're looking at stability, range of motion, or strength or power production. So I like to break it down into those 3. First of all, always trying to gain some range of motion. So okay, what isn't moving? How do we get it moving? And then start in that aspect, and then obviously treat the dysfunction of whatever is going on. And then after we are able to get the person to move, then we start to add in some stability. So stabilize whatever area of the spine or of the peripheral extremities that we need to then stabilize. And then after we've stabilized it, we've got good range of motion, then we can add in strength and power.
And when you say stabilizing, could you elaborate on that? What do you mean by stabilizing?
Adding in, the majority of the times with any lower back, just as an example, lower back issues specifically around the spine, whether it's a disc injury or any sort of issues around a facet sprain or whatever, just imagine the spine. The best way to go about it is to start to add support from the surrounding musculature and in essence the bracing of the core. A lot of people don't particularly understand how to brace or how to go about activating in the right way that's not going to then injure them further.
Do you find there are particular injuries that are common from yoga, for people who are engaging in yoga, or is yoga perfect all the time, or does it actually lead to injuries sometimes?
I recommend a lot of people to go and do yoga sessions, or go consistently and adapt their pick up their practice. I think it's understanding how your body moves and being able to work through different, all ranges, as well as starting to then move into other types of yogic practices is just so beneficial for life in general. And it can change not only just your physical state, but also your mental state. So I do tell a lot of people, or refer a lot of people to different yogic practices.
And what's the area, so we talk about stability, range of motion and strength. Of those 3, what is the least, let's say, people pay least attention to or undervalued element?
It's range of motion and stability for sure. I would say probably more range of motion. So teaching people, everyone's more than happy, especially guys, more than happy to be able to run into a gym and lift heavy weights and just and look good in front of a mirror. That's generally consensus of most people that go to the gym. Whereas they won't spend 15 minutes on a mat doing mobility work, or they won't then go afterwards and then make sure that they're doing their core work and then, stabilising, doing the stuff that you don't particularly want to do after you've already had a workout, which is, in essence, the most important part of training.
So the stabilisation and the stretching, range of motion, right? So how do you incentivize people to do that?
I think it just comes down a little bit to understanding the ability to be able to recover faster and the benefits that it has physiologically as to why you should do this. Well, we're all getting older. The body doesn't. The body doesn't.
I saw 2. I don't mind when I get 1 grey hair, but I saw 2 today grouping together.
At least your hair's not taking off.
No, I'm pretty good. But anyway, sorry. Yeah, we're getting older. Go on.
We're getting older. The body doesn't work as well as what it should if you don't consistently train it. But not only just train, but also keep your range of motion up. Allow for full range through all of your joints, and also provide stability so that you're not wearing down those joints in the long run. A longer, happy life can start by just paying attention to how you move, and then making sure that within that movement everything's stabilised and you're functioning in the way that you need to.
So there's also an educational element to this. Basically, you're educating, you're like providing, okay, you should do this, this, and this, but you also need to be aware that if you don't do these things, this is what the outcome is.
This is what could possibly happen.
Could possibly happen.
Yeah.
Or very likely to happen at some point.
At some point.
Yeah. Okay. So now Jake is going to examine me. Basically, I have a torn knee. That's the main thing you need to know.
Okay.
Other than that, I'm incredibly.
Tell me a little bit about your previous medical history.
So I fell off a wall when I was 16 because I was an exercise 16-year-old, and I burst my kidney. So I lost 1/4 of my kidney.
Left side.
Left side. I've torn my MCL skiing. A year and a half ago, I tore my ACL. I broke this collarbone, multiple rugby injuries. So until 21, I played rugby. And from 21 until now, I've done the other style of life. So when I started doing yoga, this was my range of motion. You know, so you go like that. And since then, obviously, because I got into yoga like a long time ago, it's improved a lot.
Continue to practice.
Continually practice, yeah. That's been the big one. Like very consistently, I would say, for some of my temperament.
Yeah.
You know. And the breathing has been massive for me. And even just the thing for me is when I wake up in the morning and I know there's this place that I can just go to and I will take care of most of the, let's say, problems that might come to me. You know, I'm going to be relaxed, I'm going to be stretched, and I know, go there, that's my hour, and then my day is going to be much better. Mm-hmm. Honestly, there's a mental relief in knowing that there's somewhere you can go that takes care of that. And one of the reasons why I think the Yoga for Men program is so interesting is because it is a real problem. You know, it's a real problem. Men can't go to yoga, or they feel they can't go because they're not getting enough advice, because their bodies aren't adapted, because there's many different reasons, I guess.
Ego.
Yeah, ego. The reason I think I've learned so many things is I have a huge ego, but my ego is so big that I don't mind looking stupid in front of people.
Yeah.
And a lot of people are unwilling to learn to look stupid in front of people. And it's the main reason why men don't learn yoga, and why people don't learn languages, for example. It's because the smarter you are, the harder it is to bear people thinking you're stupid when you start speaking a second language. Yeah.
Very cool. Well, let's get more men into yoga.
Let's get more men into yoga. Boom.
Back to you.
Oh yeah.
Shoulder, clavicle,
MCL,
ACL,
knee,
kidney, probably some rib tickles along the way. Wrist.
Broken wrist, broken thumbs.
Yep.
Some
concussions.
Multiple concussions.
Neck injuries.
No, amazingly.
Yeah. No pain through the neck or through the back.
No.
And anything else? Any pains?
Tore my left ankle. It's a bit stiff recently. I tore
the lateral side.
When you do that one after it's climbing.
Yeah.
Lots of bumps and bruises, but
pain when you wake up in the morning anywhere?
No.
Throughout the day, no niggles. No digestive system.
No, amazing.
Clean. You don't drink alcohol.
No.
Good.
My knees crunch.
That would happen if you've done an ACL and MCL before. You probably have aggravated it.
And I think my whole family had dodgy knees before as well, so they crunch, you know. But I think that just the amount of time doing yoga means that I don't have, most people of my age now, when I talk to them, they talk as if it's an inevitability. I mean, it is an inevitability that your body is going to fail at a certain rate. But I have a lot of my friends who are 38 and they talk as if they were 60-year-olds. I'm 38-year-old. I'm 38 now. You know how it is. I'm like, no, bro. I don't think it necessarily has to be that way. So yeah.
I think the body keeps a score.
Yeah.
The body remembers everything. When you're younger, or you're riding. Picture you riding a bike when you're 14 years old. You fall off, you land on your shoulder, and you hurt your leg. You don't remember that when you get to 50, but your body still has that little bit of a remembrance of that trauma that's attached to it, or that slight little bit of a bruise, or that wearing down of the bone tissue or the joint. And eventually, if it's not taken care of, or you don't work through those continual issues, then you'll find a constriction or a change within the area.
Have you ever read the book The Body Keeps the Score?
But I should.
Also, I did. I spent 9 months in Thailand during COVID, and I got a Thai massage every day, sometimes 2. For 9 months.
That would have helped your range of motion.
Yeah, that was beautiful. I loved it.
All right.
Yeah. Boom.
Let's have a look.
All right. Check it out. Thank you.